For a couple with subfertility. The term subfertility, refers when a couple could not create a child for at least 1 year. It is unlikely infertility because infertility means totally incapable of conceiving. Subfertility, for the time being, you are not able to conceive, but it is not permanent. You'll be able to conceive after some time. In subfertility, it should be treated as a couple. Not only the female should get all the treatment, the man should be equally involved in the treatment because there is a time the male partner that is having problem. But some of the time, the female partner which also having problems. Subfertility assessment used to require many months and many tests, all of which had the potential to interfere with a couple's self-image, self-esteem, and lifestyle. The couple should undergo assessments such as semen analysis, ovulation monitoring, and tubal patency. Nagre-request ang isang doktor ng semenalysis sa isang lalaki ay kapag may problema ito sa kanyang semen. Katulad na lang hindi ito siya nakakapag-produce ng semen o male infertility. At para na din ma-check kung normal ba ang ejaculation ng isang lalaki. Bago mag-collect ng isang semen ang isang lalaki ay kailangan ng abstinence o walang pagtatalik o kahit anong form ng ejaculation sa loob ng 2 to 4 days. Ovulation monitoring. It is a process that helps you identify your most fertile days of each month. Tubal patency. It is a woman's fallopian tube are not blocked. It is determined by an X-ray called hysterosalpingography. Hystero means uterus, salpingo means fallopian tube. Hysterosalpingography, it is a standard radiological imaging study that is used to determine if the fallopian tube are open and free of disease. This procedure is done after the menstrual flow. Contraindications to this procedure are vagina infections, cervical infections, and uterine infections. Talking with both partners together may be advantageous because they may feel comfortable speaking about their problem together. During assessment, we need to provide privacy for them because it is important to spend some time alone with each client in case there is anything a partner wishes to discuss privately. Just counseling, it will overcome the emotional problems of the couples. Just telling them what is right for them and what is wrong about them, and also validate their feelings.
As previously mentioned, subfertility is said to exist when a pregnancy has not occurred after at least 1 year of engaging in unprotected coitus. In primary subfertility, there have been no previous conception. In secondary subfertility, there has been a previous viable pregnancy, but the couple is unable to conceive at present. Sterility is the inability to conceive because of unknown condition, such as the absence of a uterus. Fecundity is a term as the ability of a woman to conceive within a given period. If a couple is sexually active and practices regular and protected sexual intercourse, generally within the first episode of the sexual intercourse, 25% to 30% of couple is conceived. Within first 3 months of same 40% and 50% of a couple is conceived. And by 6 months, 60% of a couple is conceived. And also, it has been said that 1 year of regular sexual intercourse, 90% of the couple is conceived. So this is how the definition of subfertility is termed inability to conceive within 1 year of active and protective sexual intercourse.
Age is related to subfertility of a woman because it is a naturally contributor to subfertility. With the advances of the age, the fecundity or the fertility naturally tends to decrease. So, because of this gradual decline in fertility, women who defer pregnancy into their late 30s are about to have more difficulty conceiving than their younger counterparts. Women who are using oral, injectable, or implanted hormone for contraception may have difficulty becoming pregnant for several months after discontinuing this medication because it takes it long for the body to restore normal functioning.
What is fertility assessment? Fertility assessment is a standard fertility evaluation, includes physical exams and medical and sexual histories of both partners.
Fertility assessment, the age of a couple and the degree of apprehension they feel about possible subfertility can make a difference in determining when they should be referred for fertility evaluation. Although some healthcare plans or specific settings set limits on the age range in which fertility testing can be scheduled, such as that before age 18 years and not after age 45 years. Other settings do not establish such limits, allowing couples of any age to benefit from assessment. As a rule, if a woman is younger than 35 of age, it is usually suggested she have an evaluation after 1 year of subfertility. And if a woman is older than 35 years, she should be seen after 6 months. Referral is recommended sooner because assisted reproductive strategies such as IVF, as well as common alternatives to natural childbearing such as adoption, are also limited by age.
There are the factors that may be responsible for subfertility for the man. First, his general health. A typical 24-hour food intake, including alternative therapies such as herbs, using alcohol, recreational drugs, or smokes and tobacco. And if he had a congenital health problems such as hypospadias or cryptorchidism. Cryptorchidism, an ascended testicle that has not moved from the inside of the body to the scrotum. And if his job or lifestyle involves sitting all day. And what his sexual practices are, such as frequency of coitus, masturbation, and coital positions used, what past contraceptive measures he has used, or if he has children from a previous relationship. Asking about alternatives therapies is important because a couple who wants to have a child could be investigating non-traditional as well as traditional methods that they have heard will aid in conception. And for women's health history, ask about past pregnancies, miscarriages, or abortions, history of contraceptive use, current or past reproductive tract problems such as infections, overall health, emphasizing endocrine problems such as galactorrhea or breast nipple secretions or symptoms of thyroid dysfunction, abdominal or pelvic operations that could have compromised blood flow to pelvic organ, also the use of Dutchess or intravaginal medications or spray that could interfere with vaginal pH, and exposure to occupational hazards such as X-ray or toxic substances. Nutrition, including an adequate source of folic acid and avoidance of trans fat. And if she can detect ovulation through such symptoms at breast tenderness, mid-cycle, wetness, or lower abdominal pain. Also, obtain a menstrual history including age of menarche, length, regularity, and frequency of menstrual periods, amount of flow, and any difficulties women experiences such as dysmenorrhea or premenstrual dysphoric disorder or PDD. It is not unusual to see a couple move through steps of denial, anger, bargaining, and depression. Acceptance in this way helps them make adjustments in their wants or plans and feel fulfilled again.
Physical assessment for men.
A complete examination of genitals including inspection of the skin, hair, and palpation of inguinal nodes, scrotal contents, and penis, and inspection of perineal area as indicated, should be performed annually as part of a comprehensive physical examination. For female physical examination, it's also recommended that females get in-depth physicals on an annual basis. Annual physical examination for women may include breast exam. Your doctor will feel for any abnormal lumps as well as check the lymph nodes under the arms. Pelvic exam. A pelvic exam allows the doctor to examine the vaginal vulva, cervix, uterus, and ovaries for any abnormalities or inspection. Fertility testing involves laboratory tests, blood tests, and semen analysis. Image testing such as ultrasound of you and your partner's reproductive organs, and other procedures to test the functioning of your reproductive system. Fertility testing for male. Sperm and semen analysis. A trained expert checks your sperm count, their shape, movement, and other characteristics. In general, if you have a higher number of normal shaped sperm, it means you have higher fertility. But there are plenty of exceptions to this. A lot of guys with low sperm counts or abnormal semen are still fertile. Fertility testing for female. Ovulation testing to confirm if ovulation is occurring by looking through your temperature charts, using ovulation protector kits and blood tests and ultrasound. Ovarian function tests. These tests are looking to see how the hormones are functioning and working during your ovulation cycle. Luteal phase testing. Testing will evaluate progesterone levels, more extensive hormone testing, and possible endometrial biopsy. Hormone tests. Most all of this testing will revolve around thorough hormone tests.
Men and women contribute equally to the causes of subfertility. 33% of the time, it is due to female factors. Another 33% is because of male factors, while another third are because of both men and women. However, there is no identifiable cause for about 1 in 10 couples who face infertility. Although it takes only 1 sperm and 1 egg to make an embryo, men have the provision of abundance of sperm from nature. That's because in natural conception, there is a long route for the sperm to traverse to meet their goal, a mature egg. In this long race, the sperm's endurance is put to test. Only the fittest can reach the fallopian tube and fertilize the egg. There's 3 main factors in male subfertility. The first male factor is abnormal sperm parameters. There are terms to describe the various sperm parameters, which are oligozoospermia, which means there is a decrease in sperm quantity, estenozoospermia, which is the decrease in sperm motility, and teratozoospermia, which is the decrease in normal-looking sperm. Sexual dysfunction is also a cause of subfertility. This can be erectile dysfunction, premature ejaculation, or even retrograde ejaculation. These may be due to prostate surgery, nerve damage, the timing of intercourse, or medication. A third of male causes are unexplained. It might be due to problems in producing hormones for sperm production. It could also be that there is a blockage of sperm transport, which might be caused by previous infection, prostate-related problems, or an absence of a vas deferens. Another cause might be problems in sperm production, which can be caused by various reasons, such as genetics, failure of the testes to descend, infection, torsion, varicocele, drugs, radiation damage, sperm antibodies, or heat. So, let's talk about female factors. There are 5 of them, and the first is that there might be a problem with the woman's ovaries. Some women have problems with ovulation. This means that a mature egg is not regularly produced. This is often seen in women with PCOS. Other women might have problems with their ovarian reserve. This might cause the early closure of a woman's fertility window and might be due to the woman naturally having a diminished ovarian reserve, premature ovarian insufficiency, age, endometriosis, or history of ovarian surgery. Secondly, another main cause of subfertility is due to the woman's tubes. This is somewhat like a roadblock on the passage for the sperm to meet the egg. A woman may have problems with blocked tubes due to various reasons, such as pelvic inflammatory disease or endometriosis. A history of tubal or pelvic surgeries can also cause scarring from outside the tubes and cause occlusion. Lastly, hydrocephalus, which are dilated tubes filled with fluid, is also a cause of subfertility. Toxins from inside the swollen fluid-filled tube may backtrack into the uterus and cause the embryo to fail to implant. Another main factor is the uterine factor, which means the soil for the embryo to implant is compromised. There might be problems with some growth within the uterine cavity. This might be endometrial polyps or submucosal fibroids. Cavity distortion, which is compression and pressure on the uterine cavity, may also cause subfertility. This might be caused by large intramural uterine fibroids, adenomyosis, or congenital uterine anomalies such as bicornate or unicornate septic uterus. Also, sexual dysfunction is another cause of subfertility. This is defined as the inability to have penetrative sex, which might be vaginismus, or dyspareunia, which is painful sex. Lastly, a woman's general health is important as well when it comes to fertility. Nurturing a growing fetus is a demanding task on a woman's body, and any poor health will compromise the ability of a woman to undertake the process of conception and pregnancy. Thus, chronic medical illnesses which are not well controlled, such as diabetes, thyroid dysfunction, autoimmune diseases, or cancer, may affect a woman's fertility.
Limited sperm count. The sperm count is the number of sperm in a single ejaculation or in a milliliter of semen. The minimum sperm count considered normal has 33 to 46 million sperm per milliliter of seminal fluid, or 50 million per ejaculation. 50% of sperm that are motile, 30% that are normal in shape and form. Spermatozoa must be produced and maintained at a temperature slightly lower than body temperature to be fully motile. There are 5 causes of low sperm count. The first one is high temperatures. Sitting for long periods, wearing tight clothing, or working on a laptop computer for long stretches of time might increase the temperature in your scrotum and slightly reduce sperm production. The second, medical treatments. Certain medications such as cancer drugs, ulcer medicines, and blood pressure medication can impair sperm production and reduce fertility. The third is infection. Sexual transmitted infections such as HIV, gonorrhea, and etc. It can cause blockage of sperm pathways, leading to low sperm count. 4. Undescended testicles. Cryptorchidism is a condition when one or both of testes have not descended into the scrotum at birth, but stay in the abdomen or only move halfway down. The last one is other causes stress, physical or emotional, alcohol, tobacco, smoking, obesity, toxins from industrial chemicals, and ejaculation problems. Having a low sperm count does not entirely mean that a man cannot impregnate his female partner. However, a low sperm count will decrease the odds that one of the man's sperm will fertilize a partner's egg, resulting in pregnancy. Testing for sperm number and ability. Analysis of pituitary hormones. If your doctor suspects a problem with your pituitary hormones, he or she will likely order several tests to check hormone levels in your body and search for a cause. Your doctor may order tests including blood tests. These tests measure your hormone levels. For example, blood tests can identify low levels of thyroid, adrenal, or sex hormones. The test can determine if these low levels are associated with pituitary hormones production. Semen analysis, also called semenogram or spermiogram, evaluates certain characteristics of a male semen and the sperm content therein. It is done to help evaluate male fertility, whether for those seeking pregnancy. Semen analysis, dito tinitignan o tinitest kung okay ba ang quality ng sperm ng isang lalaki at ang dami nito. Sperm penetration assay and anti-sperm antibody. The sperm penetration assay checks if sperm can join with an egg. This is also called the hamster donor free ovum test or hamster test. Sperm are mixed with hamster eggs in laboratory. The number of sperm that penetrate the egg is measured. This test is not done often, but it may be done at a special fertility centers that do in vitro fertilization. Is there any risk of sperm penetration analysis? There are typically no risks associated with sperm penetration assay, as the collection of the semen sample is provided by masturbation.
Therapy for increasing sperm count and motility. The word motility, it is a movement or the ability of sperm to move. The number of sperm found in one semen sample is referred to as a sperm count. An essential function of healthy sperm cells is their ability to swim. Healthy sperm motility is defined as sperm with forward progressions of at least 25 micrometer per second. If a man has a poor sperm motility, it is called astenospermia. And azoospermia, it is a no sperm count or zero sperm count. If sperm are present but the total count is low, a man may be advised to abstain from coitus for 7 to 10 days at a time to increase the count. There are helpful ways to reduce scrotal heat and increase the sperm count, such as start exercising on a regular basis. Exercise is associated with a number of health benefits and can help improve your sperm motility by regulating hormones and contributing to weight loss. An example of this is walking. Next is wear loose-fitting underwear to keep your testicles cool. Avoid wearing tight-fitting underwear and pants that keep fabric snug around testicles. Avoid long periods of sitting. If your workplace is hot or you spend a lot of time sitting down, take breaks to stand up and walk around where it's cool. Manage and reduce your stress. The stress of trying to conceive as well as everyday life events can reduce your sperm count and slow sperm motility. An example of this is deep breathing. Obstruction or impaired sperm motility. In some men, adequate sperm are manufactured, but there is obstruction at some point along the pathway where the spermatozoa must travel to reach the outside, from the seminiferous tubules to the epididymis to the vas deferens to the ejaculatory duct and through the urethra during ejaculation. But there are diseases why the spermatozoa can travel to reach the outside, such as mumps orchitis, or inflammation of testicles due to the mumps virus, having an inflammation of epididymis called epididymitis, and infections such as gonorrhea or ascending urethral infection. In this table, it is a nursing care planning based on family teaching. So here are tips for ensuring to get an accurate semen analysis.